This presentation is brought to you by Therapeutic Articulations, the creator of the Mobil-Aider orthopedic device and iOrtho mobile app. This presentation is about elbow mobilizations. We're going to speak about the following elbow mobilizations: humeral ulnar medial glide for elbow flexion, humeral ulnar lateral glide to facilitate elbow extension, humeral radial anterior glide for flexion and pronation, and humeral radial posterior glide for extension and supination. To perform a medial humeral ulnar glide to facilitate elbow flexion, you place the patient in the supine position, the arm is at the side, and the elbow is flexed at 90 degrees. You typically allow the forearm to be draped across the anterior abdomen. The clinician will stand on the ipsilateral side, will contact the distal humerus for stabilization, and place the thenar eminence of the other hand posterior over the olecranon and proximal ulna. They'll then translate medially in an attempt to improve elbow flexion. The Mobil-Aider device allows you to quantify these mobilizations. So by attaching the HE attachment, the green attachment, to the device, you can place the device just as the clinician's hands will be placed on the patient and perform the identical medial glide to facilitate elbow flexion. This would look something like this. The green device slips in to the custom dovetail. You palpate the joint line, right? Place the proximal component on the humerus to stabilize, and you translate the distal component. And there you can see the oscillations that are associated with the gliding technique. For a lateral glide to improve extension, the same position is imparted on the patient, right? But the actual mobilization is a pulling technique. And so now the clinician is pulling upward with the thenar eminence placed posterior over the olecranon and proximal ulna, and the direction of the forearm indicates the movement of the translation. So you see the clinician's forearm is parallel to the direction of movement. Likewise, we can use the Mobil-Aider to do the same technique, but now we flip the Mobil-Aider around so that it can allow the clinician to pull instead of push. Again, you slide the green attachment, the HE attachment, into the dovetail, stabilize proximally, and translate distally. And again, you're able to see a quantitative value on the LED screen so you know exactly where you are in the joint mobilization technique. If you wish to do a grade 4 mobilization and the patient has 4 millimeters of translation, then you know you want to be in that 3 to 4 millimeter range on every single translation, so that you're doing a controlled small amplitude translation at the end range of the restriction. For humeral radial glides, there are anterior and posterior techniques. The anterior technique improves flexion and pronation, and in this case, the humerus is supported on a towel. The clinician stabilizes that humerus against the towel and grasps the proximal radius in what's known as a 3-jaw chuck pinch contact. And now that radius can be translated either anterior or posterior, depending on the movement that you wish to facilitate. So here's an anterior translation for flexion and pronation, and here is a posterior translation for extension and supination. If you're interested in more information about the MobilAider device, please email info@iortho.xyz or visit the website for more videos and additional information on the device and the app. That's iortho.xyz. Thank you.